Well, when we talk about cancers, there are a lot of different types that normally come to mind. There's a couple that might not be the first thing you think about, and that's why we have Dr. Philip Khalil joining us this morning from Summa Health to not only discuss what those are, but also for us to really learn signs and symptoms so that we can stop this before it gets out of control. So, Dr. Khalil, thank you for joining us this morning.
Thank you for having me. Appreciate it.
So we're discussing specifically head and neck cancers. And for me, those aren't two types of cancers when I think about that come to mind. Do you find that a lot of patients don't normally think of those first when they're discussing or concerned about certain cancers that could develop?
Yeah, I mean, absolutely. I think, when most people think of head and neck cancers, it's not something that they have a lot of awareness about. And, traditionally, these cancers have been seen in, patients who are older, typically in patients who are heavy tobacco users, as well as alcohol consumption. And so, a lot of these cancers will tend to present late because these patients don't really think about the signs and symptoms associated with them. And unfortunately, like all cancers, the later they present, the poorer the prognosis. So, regardless of the type of cancer you're talking about, early detection, early screening, and early intervention are the keys to success.
What are some of the signs and how can you get screenings to catch these things early?
Yeah, so most, I think, patients have experienced on some level when they go to their dentist and they're evaluated after their teeth are cleaned. I think most dentists will do an oral exam. Some patients may not even be aware of what's going on, but they'll look at their tongue, they'll look underneath their tongue, look at the back of the throat, feel around, and basically what they're looking for are any lesions, anything that's a growth or an unusual appearance. So that's always good. I think regular dental cleanings and dental visits is a really good way to screen for this. I think a lot of dentists will pick up on these lesions appropriately. And then I always tell patients, it's kind of a rule of thumb. If you have a growth anywhere, so a lot of times in head and neck cancers, frankly, they will present as a lump in their neck. And that's indicative that it has involved a lymph node. And so, if you're an adult and you have a lump or a growth in your neck, it really should be evaluated. It shouldn't be ignored.
When do they come to you in this process? Because clearly I know Summa Health is doing a lot to really assist in this specific department. So when do they come to you and then how do you facilitate things?
We have a pretty comprehensive system here. When a patient is first diagnosed, we actually have a nurse navigator who literally is there at that first visit and helps the patient kind of navigate what needs to be done, what testing, additional testing to get the correct staging. And then we have nutrition support, speech and swallowing support. They make the appointments with radiation oncology, medical oncology, really quarterback and coordinate their care. And I think it's a great setup because I think these patients really, the diagnosis is shocking enough. And then
Sure.
to have to navigate, all these other components, I think it's incredibly important to have that ability to help the patient through that.
Well, and I think that's what's evident of anyone who knows anyone who's gone through cancer and treatments. It's having that team mentality, feeling like you don't just have one person on your side, you have a whole team of people on your side guiding you through that. And that's what you do there at Summa Health. And
Yeah.
I think that's why we're so appreciative to know that we have this right at our fingertips here when you're needed. So Dr. Khalil, thank you so much for joining us and thank you for what you do every day.
Thank you. Appreciate the time.